PLC Safari Rally 2025. Red Fisher and feel the roar.
Kabatin chitap kalenjin eng uitugul ole imite kakoit boroindo nebo logoiwekab emet kainenyu ko Chesankaro Sirma ak kabarastaindet nekimite tuwai eng oretab kabarunet ko Naomi Cherotich. Ko kitaune taonit bo Nairobi ole katach President William Ruto kiyokik chotok chelelachen chebunu emotinwek cheterter chebo sang chetetat koboisiechi emotinwekwak eng emoni. Kiyokik chotok kobunu emotinwek cheboto Angola, Cuba, South Korea ak Vietnam. Kamwa Ruto kole chobot serkalinyi kobois ak kiyokik chotok eng kanaptaitab tilyandit nemie eng kwenutab Kenya ak emotinwek chotok.
Your Excellency, the President of the Republic of Kenya, I have the honor to present to you Ms. Vu Tan, Ambassador Designate of the Socialist Republic of Vietnam, with residence in Dar es Salaam.
Your Excellency, respected President, my great honor to be here today to present Your Excellency the credential letter from my President, His Excellency Luan Khun, appointed me as the Ambassador Extraordinary and Plenipotentiary of the Socialist Republic of Vietnam to the Republic of Kenya.
Your Excellency, Habari Yako, please allow me to convey compliments of Acting President Choi Sang-mok and the people of Republic of Korea to you and the people of Republic of Kenya.
I, William Samuel Ruto, President of the Republic of Kenya, by date of Article 132(4)(b) of the Constitution of Kenya, do accept your letters of credence and authorize you to pursue the interests of your government within the territory of Kenya by fostering the bonds of friendship and promoting to the widest possible within the law the aspirations of the peoples of our two nations. Ambassador, congratulations on your appointment. Welcome to Kenya. I look forward to working with you and my very best wishes. Thank you.
Ketesetai ko kakomwa Governor nebo Nandi County Stephen Sang kole nyolu eng Ministry nebo tililindo koisto terchinosiek chemiten kwenutab serikali ak ofisaek chebo tililindo eng mwaet kole weche notok kasuldaetab tetutikab konyoiset eng emoni. Kamwa Sang kole manyolu kitaban clinical officers eng tuget nelel notok nebo konyoiset nebo SHA eng mwaet kole ofisaek chotok koyoe boisiet neo ako nyolu kekoshi rirekwak asikobit mawechokis tetutik chebo konyoiset eng sipitalishekab boror eng emonito. Kinyoru sirindenyo Cornelia Saketer asikwarorwech eng koindo.
Kailos Governor nebo Nandi Stephen Sang tugetab konyoiset nelel nebo SHA eng mwaet kole tindoi tetutikab konyoiset chemi barak ngekerchin ak nekibo NHIF ole kamwa kole ngalek chekotestai koletagei kele makararan tugonotok bo SHA komobo iman ngamitei kewelutik chengeringen eng tugonotok chetesetai serikali kolititi.
If you look at the tariffs that are being implemented under SHA with regard to the various categories of health service provision, there is a huge improvement. A very good case or example is that previously under NHIF, as a cesarean section, the county would claim only or would be reimbursed only 5,000 shillings. As we speak today, under SHA, the county will be reimbursed 30,000 shillings. That means that the opportunity to increase the resources, courtesy of service delivery to the facility, and now that we have the facility improvement fund facility, means that all these resources will be claimed and the money will be given back to the facility for improvement.
Kasom sang SHA konde tai ketesyosyekab konyoiset chebo serikali eng katyaktaetab chepkondok eng kasarta neititaat kosubkei ak netiegei sipitalishek chotok chepkondok chotok eng kakoitoetab tetutikab konyoiset koityi biikab boror ak korirtae ine ministry nebo tililindo eng nikitaban konyoik chenotin ko clinical officers eng nemoityin tugonotok bo SHA eng kasuldaenwa nebo konyoiset.
And we are also asking SHA to prioritize particularly health facilities within the public sector in terms of their reimbursements so that this process can be made faster. We sat down as the Council of Governors, had a discussion on this particular matter. We even signed an agreement that the Ministry of Health were going to implement the law by ensuring that clinical officers are allowed to participate in the service provision as allowed by law as they have always done under NHIF and now under SHA.
Kamwa sa kole nyalu eng ministry nebo tililindo koityi kamanut matwet age tugul nebo konyoiset ak koisto terchinoshek chemiten kwenunwa kokoch matwet age tugul boroindo nebo kosuldae boisienwa eng oret nenyalu ak nekikoch katiba.
What is the reason why the Ministry of Health, SHA and Digital Health have not allowed clinical officers to do their job? Because of unnecessary sibling rivalry, maybe between doctors' union or the Doctors' Council and the Clinical Officers' Council, we now have an industrial action nationally that is affecting us. When the issue is something that can be sorted out, it was agreed upon, we have an agreement on it, the law allows. But then, for some reason, some senior officers within the Ministry of Health are taking their sweet time and appear as if they want to frustrate that process. So we want to ask the ministry, please, we have more issues to deal with. We are already dealing with those issues. We are your partners in the rollout of SHA, but allow each and every cadre of healthcare workers to contribute to the successful implementation and rollout of SHA.
Kongete taunitab Kapsabet eng county nebo Nandi, logoiwekab emet chebo Kass, kainenyu ko Cornelius Keter.
Ketesetai county noto bo Elgeyo Marakwet kosuldae tetutik cheterter chetokchingei kokanapta boisionik chetinyegei ak konyoiset ko oret agenge nebo kekanapta tililindo eng komaswek tugul chebo county noto. Nito kosubkei ak CEC nebo tililindo Monica Rotich nekamwa kole alak eng tetutik choto ko kanaptaet nebo sipitalisiek ak aletab kerichek eng kasarta nenyalu. Kang'alali Rotich eng Kass FM International eng karonetab rani eng tetutiet nebo alet ne emet.
Magoi keba mbar, magoi keyai kiy age tugul komatinye biik afya. Kwa hivyo kikonok assurance biik cho kelechok we will give you our best. Ngalekab kerichek chekakoteb Saidi kihakikishani kole mito kerichek eng sipitalishek. With SHA kokokelechi sipitalishek kora eng ole much mait keal kerichek keale rabinik chekinyoru eng exchequer imuch sipitalishek kora kwaljigei ako kotoi kaptaro kwak sipitalishek alak konyor accounts ak KEMSA so komuch kwal kerichek. So ngalechu bo kerichek okonech a few months most of the things itakuwa sorted. Assurance kora nakochini biikab Elgeyo Marakwet ameche ke compare devolution ak atkinye komami devolution. Abkwati sai ale anabunu ole kure koitugu sub location kulen biik nyuma ya ID. Ki betut anono atkinye kimuch Elgeyo Marakwet kimuch kenyoru assistant minister agenge eng national. Kina Marimoi, kina Lina Kilimo ko ki chito agenge eng the whole county. Lakini sai kikechaguan governor kitinye waziri 10 eng Elgeyo Marakwet ne imuch chito nebunu Endo imuch kobirchi waziri nebunu oloto akolechi waziri kami ng'olyobuni akot issue amu waziri sai nebo Endo komi agriculture mbate ma issue nebo agriculture imuch kolechi kami shida tot sipitali chengwa waziri nebo afya sikong'ene sikotoretech. So assurance na amache akonok biikab Elgeyo Marakwet devolution ko kinyo sikotoretech akabwati ale ngache tugul chekimi office ketiemes kekonok services to our level best. In afya kora mito emergency services eng Elgeyo Marakwet ketinye ambulances chekitinye almost in every ward. Kung nyoto kikondonaiwech raia rabinik eng public participation konde rabinikab mwaita ak services chebo ambulances. So services sai chebo ambulance ko free. Ako emergency Kenya ko moche sikotoretech coordination. Kokonech tracking chebo those tracking chebo ambulances, kokonech service unit, a service call center. Ne imuch kopir biik simet akole mi chepyoso nemoche ketoret nemiono, nemi chepsirei, mi chepyoso nemi embabut, nemi mung'wa nemiono, makat ketoret. So kitinye noto akonyo kochopwech bichoto. So assurance namoche akochi biik chobo Elgeyo Marakwet. Kitieme kekonok services ak kekonok services to a level best. Amoywei oteb maswali. Kakelecho ki accountable.
Yetesetai ko korus kwang'et meng'ikab Lekimbo eng kebeberta noto nebo Bomet East kongenamchi muren agenge nebo kenyisiekab kwen tuguk cheterter chotok chebo chorset cheboto ngoroikab kwonyik ak tuguk alak chechang. Morubeiwotab kirwokindet nebo komasata Daisy Sawek kole kakotoi chikilisiet kotinygei ak yautik chotok kosom biik chotok che kokichore tuguk komongei akosir logoiyot eng ketesietab polis asikobit keipchi chichotok kakwautik chebo kergong'et konamgei ak ng'atutiet ko kenyoru kit nekotestai.
Kokimuch kenam report kele miten chi netindoi tugun che suspecteni biik kobo chorset. So kayumak biikab kokwet akoyom konai kole tos tuguchu ko ne. So en betutab raini ko kakimuch kebut kotab chi nekikuren Gabriel ne suspecteni biik kouon kochorso ak kityo kelol tuguk chemiten ko chechang ko ingoroik boto kora tuguk cheu mokomboik, tugukab imbar, chang tuguk chekokelol boto ketik ako en tuguk chekakilol ko mami chi nekako-identify ine missing kit nenenyinet nekimokibwote kora kele imuche kokichoren ele nekit anan kotko ele mwoitoi ine chichoton Gabriel komwoe kole len kiole tuguchoton. Ko kit nekosome biikab kokwet ko kotko miten chi nekako-identifyen kit nenenyin kotoretech komwa kit nenenyinet sikobit keib hatua ak echek ko ki serikali. Yon kakinyoru kit nekako-identifyen chito kole kit nenenyinet keibe hatua. Kimuche bakesir statement ak keib ak kesib the right procedure kot keit kotini. Kobwan kora kou niton ak kelole tuguk kou niton amamiten chi nekiib kit nenenyinet. Okot biik chekiko-identifyen tugukwak komapiken ko kikakiib tuguchoton koba kotini kelele koba police kelele sikosib biik chechwak ak kityo bakosir statement. Lakini monyo chi konyokosir statement kereleasen kou noton. So for the last 2 years ko kokimi ireu kora kou niton. Abwoti ale nebo oeng.
En kainet kekuron Bernard Kirui, Zabwad administrator nebo Emitiot Supplication. En betut nebo raini ko kanam simoisiek chechang kobiru biik kolen miten biik chechang chekakoumgei en kebeberi bo Kobole, kainet kekuren Kobole chichi. Ko kangerwou ak kirwokindet kenyoru biik chechang ak kenyoru biik kobute structures chebo werito. Karusei kwang'et kan kokakenyoru tuguk chechang, mararenik, ingoroik, tuguk chechang chekergei ak chekakinyor kora en kasarwek alak amun kikakibwan kora kinyokeker. Ko karus kwang'et biik chechang ako kimiten en mshangao ak kakemenejan kitulisan.
Ketesetai kokoboisie Tatu City silingisiek bilionisiek 2.5 eng teksetab korik chekikonore tuguk chebo mung'aret anan warehousing and logistics eng takchinetab komuktochi chemung'arainik kosuldae mung'aret eng kebeberata. Eng tetutienoto kimang'u konyor boisionik eng oleo chong'indab barnotik eng komasatak bo Tatu City. Ole kamwa ofisayat neo eng Special Economic Zone Authority Kenneth Chelule kole tesetai serikali kokonoptoi kibagengeisiek cheterter ko oretab komuktochi ichek kosuldae mung'aret akobara mung'aret ak boisionik. Alak eng kampunisiek chebendi kosuldae mung'aret eng yoto koboto Beckles, East Africa ak Novis PLC. Eng komastanyi komafsayat neo eng Kenya Investment Authority John Mwendwa kole kakwautienoto kowendi kale kokanaptoi ole mung'arosiek chemengechen eng komasata ako kosubkei ak Tatu City kotetei kotoi teksetab phase 2 nebo kebeberta neimuchi kosuldae mung'aret kampunisiek cheterter koitei let nebo kenyitab 2025.
The government has been very strategically trying to attract and retain investments. As the Kenya Investment Authority, we are the agency that is responsible for this agenda across government, whether you're in the special economic zone or an export processing zone or outside there. It's our business to make it comfortable for you. The first point is really trying to see that we facilitate investments by ensuring we facilitate a conducive business environment. And doing that calls for, a predictable business environment. So we want to reiterate this morning that we are committed to champion your interests as private sector. We are really trying a sector-focused view that enables us to really attract investments in areas that we are competitive as a country. And we believe the ecosystem, such as the link and what Tatu City has been able to do, is really part of being competitive. And what do I mean by that? There is the ease and there is a cost of doing business.
As you've heard, this business link that has been set up is largely for small SMEs. It's our intention, and I'm happy that Tatu City is leading in this, that we strategically grow our own businesses to come along and copy from some of the best practices from FDIs. So, as he said, it's moving. And at this stage, actually, I want to say that we've licensed a total of 43 special economic zones across the country. And we have got over 90 enterprises now fully licensed and operating within some of those zones. This is one of the many news we will witness this year. I think there are many more. And I'm happy that the trailblazer in terms of, as he said, Tatu City is leading the way on that.
Tatu City, this is a facility and project that we developed based on market demand. We saw the need to cater to small, medium enterprises in Kenya, but in both internationally, to give them a compact but yet expandable facility where they could start with as small as 850 square meters, but grow into any size that they wanted here. So this allows companies to get a foothold in the market or expand and do so in a modular way.
Kitokchinigei Senate noto ole mitei taitab bunge nebo Senate minister noto nebo ripsetab kalyet eng emet orit noto ko Kipchumba Murkomen ole walu tebutik chotok chetinyegei ak ripsetab kalyet.
His response to Senator Hamida's question, the Honorable CS made reference to a reallocation of the funds that had been requested to renovate Nyayo House. I do not know whether the Honorable CS is aware that the basement to that particular building, which is actually an exit and entry to the lifts, is in a sorry state. There is leaking water or sewerage that is a serious health hazard. And secondly and lastly, whether the CS in his comment about the Maraga Task Force recommendation has plans to implement that particular report, and if so, when will that be implemented in the police force?
Those are two questions, Senator. So, Senator Mandago, final question.
Thank you very much, Honorable Speaker. Mine is not a question, but I'd like to ask the CS that it looks like there are too many incidences associated with KWS officers. We had an incident in Nakuru. We had an incident in Tana River. Probably your ministry should put a little bit of focus on the officers. And finally, Honorable Speaker, I request the CS probably if we could visit Marsabit just to assess the situation. And
very well, Senator.
The other manyatas after this comes so that they can go back.
You're only supposed to ask one question, so the CS will only answer one question. Senator Kavindu, final question.
Thank you, Mr. Speaker. Mine is to ask Honorable CS about insecurity. This is insecurity that Senator Murango is asking about is not only in Murang'a, but also in Machakos. We have a lot of insecurity, especially in a place called Matungulu, Machakos County. and other small areas. What are you doing about it? And also transfers of the police, which have been in our station for more than 3 years. Thank you.
Thank you, Senator. Cabinet Secretary, you can respond. You only have 5 minutes to respond.
Thank you. I will be as brief as possible, Mr. Speaker. On the question of preventive measures in Kirinyaga, we have listed them in the statement on some of the preventive measures we apply, including preparation, early preparations, working with local community, strengthening Nyumba Kumi, intelligence gathering, training of the officers. So all of them are listed in the statement already, Mr. Speaker. On the question of Senator Muma, I agree with her that this is the time to do so. And this is not just a role that is played by national government. County government also has a responsibility. And to be fair, the county government last year did some good job working together with the national government. The only challenge we continue facing as a country is budgetary constraints. But to agree with you, because now Kisumu is one of the areas that is forecasted to have higher than normal rains, it is important for us to do what we need to do now. And I think we will do everything humanly possible within the budget that we have to do so. On the Senator Sigei's on Nyayo actually is, to be honest, Nyayo needs urgent attention, particularly when it comes to the lifts. Anybody who, I have an office there, so I get stuck in the lift many times. So I have a personal experience, including using the basement you've talked about, leaking and so forth. But then when you have a budget situation or austerity measures, you are struggling between providing social services, health and others, and renovations. And that's why we are facing the situation we are facing. But we will continue working to see what we'll do with Nyayo House. But I agree with Senator Sigei. And also that in the Maraga report, Mr. Speaker, we are implementing Maraga report in total, including already improved salaries to police officers of a lower cadre. These issues about transfer is being worked out.
Ketesetai kotetat kong'ololchi sirikab logoiwek eng nguno minister noto nebo tililindo noto ko Debra Baraza ole mitei inendet kebeberta noto nebo Afya House ko kibendi agenge eng agenge asikobit kenyoru ng'alalanata ole ng'ololichin sirikab logoiwek kotinygei ak ole uu atepto nebo tililindo eng emet.
Can we proceed? So, ladies and gentlemen of the Fourth Estate, good morning. I welcome you all to this week's press briefing, where we continue to update the public on the progress of the universal health coverage and other key developments in the health sector. As you know, healthcare is at the heart of our national agenda, and we are committed to making quality, affordable, and accessible healthcare a reality for every Kenyan. Today we'll focus on critical updates regarding health financing, service delivery, transparency measures, and digital transformation in the health sector. Let me begin with some of the key reforms under the Taifa Care Program and the broader UHC framework. Regarding the global budget allocation and payment based on patients served, we are implementing a new model for financing our primary health care system, where payments to facilities from January 2025 are based on the actual number of patients served, rather than just those who were insured under the old NHIF system. This is indeed a significant shift from the previous NHIF, where payments were only for NHIF-insured patients who had paid their premiums upfront. In addition, the old capitation model allocated funds to a few pre-chosen facilities and limited the scope of coverage, especially for the public health facilities. Under this new system, facilities will receive funding based on verified data of services provided, ensuring fairness, efficiency, and accountability in how healthcare are distributed. It is noteworthy that payment for PHC services is fully tax-funded, a key principle in UHC service delivery. This approach will not only ensure that healthcare funds reach the right places, but will also strengthen service delivery by prioritizing patient needs over insurance status. Regarding Taifa Care, which is the most ambitious health program since independence, the Taifa Care model is, again, it is a success, and it is actually progressing well. Yeah? It is not optional, but it is a must. Taifa Care has the potential to completely transform our health sector, ensuring that every Kenyan has access to quality care regardless of their financial situation. We understand the scale of this program, and that is why we are working hand in hand with counties, healthcare workers, and development partners to ensure seamless implementation. We ask all stakeholders to rally behind this initiative, as its success will change the health landscape of this country forever. To ensure that those who need financial support for healthcare receive it, the ministry will finalize the means testing model by 7th of March 2025, which is on Friday, and this model will ensure that vulnerable groups are accurately identified and supported, reducing financial barriers to healthcare access. Additionally, we are developing a manual to guide counties and healthcare providers and the citizens on how to access services under the digital model. For our focus on primary healthcare remains a top priority. UHC is designed to drive more people towards the primary healthcare services, ensuring that diseases are detected and managed early before they escalate into costly emergencies. Utilization data for January 2025 clearly confirms that we are on the right trajectory. This will also reduce the pressure on higher-level hospitals, ensuring that referral facilities focus on complex cases, while primary healthcare facilities handle routine care, preventive health, and early disease management. We call on Kenyans to embrace primary healthcare services, which will be more accessible, affordable, and effective under the new system. At this point, I would like to invite the DG for Health, Dr. Patrick Abmoth, to take us through the key updates on transparency in health financing, digital transformation, as well as facility management. Dr. Abmoth, over to you.
Thank you, Madam Waziri. Just to... oh.
It's okay.
Well, the boss said.
No problem, DG.
Okay, thank you. Thanks, Madam Waziri. I think you have been very, very comprehensive in your laying the background, and therefore I'll just put emphasis on a few areas. I want to emphasize the fact that data from utilization of facility data for the month of January is clearly indicating a shift of our patients moving from higher level facilities towards the primary healthcare facilities. You know, primary healthcare services or facilities are comprehensive, they're integrated, they promote equity and inclusivity. And this is a good thing happening for us, especially the dwindling donor space. Therefore, we can be able to stretch the shilling to be able to deliver more health. In the month of January, we had more than 406,000 visits, and the majority of those visits were to public health facilities. We are proposing to pay about 877 million, 54% of that will go to public health facilities, unlike the previous past, where the private facilities have received a bigger chunk of capitation payment. Again, this will also be able to remove that barrier that was created by pre-chosen facility. Now, based on this, because we use the number of people who have registered to budget, it means you can be able to go to any facility. You are not restricted to a particular facility to receive services. Facilities will be able to submit returns upon which then SHA will be able to make the reimbursements. So it gives you the latitude that you are not restricted. If you come from Kwale and you are in Busia, for example, you will be able to receive the services. Busia, the facility in Busia, will lodge the claim with SHA, and SHA will be able to pay that money. So going forward, the money is going to be at the facility level, and we want to urge the county government under the FIF Act to be able to strengthen the committees at the health center level, the dispensary level, so that upon receiving the money, they can be able to prioritize procurement of health products and technologies, especially medicines, laboratory commodities, and also the requisite equipment to ensure continued service delivery to the people. Waziri has talked about the means testing. We are finalizing this on Friday, the day after tomorrow. It will be more robust, more user-friendly, and you'll simply log into the system and put in your ID, and based on the data that is the back end, then you give us a consent and we'll be able to determine how much premium you are going to pay. As at yesterday, more than 3.86 million Kenyans have done means testing. We urge more Kenyans to be able to complete that journey. But also linked to the means testing is to ensure that you onboard your dependents. Please, please, Kenyans, when you do the entire journey, make sure that your spouse and your children are on the system, because you could be up to date in your payments, but if you have not onboarded your dependents, they will not be able to access the services. Then, in terms of capacity building of the healthcare workers, we know the challenges that we have gone through. We are developing a manual together with SHA and the consortium to be able to explain to the healthcare workers the journey that they need to undertake as they offer services. And we are hopeful that in the next 2 or 3 weeks, this manual should be up and running, and it will be a reference document that one can be able to refer to at short notice to ensure that patients continue to receive services. That is coming from the fact that many times people go to the facility, the health worker who is dealing with you is not familiar with the system, and instead of asking for help, he or she tells you that SHA is not working just because he or she is not familiar with the system. And because they don't have a document to refer to, then that becomes a challenge. So we believe, working together with the counties and all the providers, with this manual, we should be able to assist any person who is coming to seek for services. The CEO is seated right next to me. Payment for facilities is going to be a public thing because it is public money. I want to assure you that, and CEO will confirm, that the money that we paid from claims of dating from 1st of October to 31st of January 31st of January 2025 are up in the website for anybody to be able to see which facility was paid, how much was that facility paid, and it is subject to the public to be able to view that information. If there's any facility that does not appear in the published list in the website, please reach out to SHA management for clarification. We also want to appeal to the health facilities to be able to onboard on the health information exchange system. DHA will be able to give support, especially to the public health facilities, so that you can be able to run all your systems through the system. We have also finalized our call center in partnership with Safaricom. We have signed a service level agreement with Safaricom that a call that comes, I think, is given 20 seconds. At the ring of 20 seconds, every call that comes through shall be answered. And we are going to beef the capacity of the call center to be able to respond to all queries raised by providers and Kenyans seeking healthcare services. As at yesterday, more than 20.2 million Kenyans had registered under SHA. Remember, in the previous NHIF dispensation, in the more than 50 years of existence of NHIF, that number was 9 million. We have been able to onboard an additional 11 million Kenyans in a span of just 5 months. So Kenyans are embracing, joining the Social Health Authority platform. And remember, universal health coverage is a journey. It is not an event. It's not something that you begin today and tomorrow you have achieved. So let's work together as one whole community, address the challenges as they come collectively. I am glad the system is now very, very stable. We don't receive any complaints of the system being down, and therefore things will only get better if you work collectively. Thank you, Madam President. Questions?
Thank you. Gloria Mzima from KTN. My questions are with regards to the Auditor
Ak eng logoiwek chebo ureriosiek komitei emoni president nebo kibagengeitab labatosiek eng ng'wony Sebastian Coe kayai tuyet ak ng'alalet ak minister nebo ureriosiek ak president nebo Athletics Kenya ole kang'alale borietab doping ak gender-based violence.
We wanted to discuss two key areas. One was the ongoing fight in the anti-doping space, which the Kenyan government have been so supportive of all our efforts. And the second key area, and the very prominent challenge around gender-based violence, not entirely or uniquely linked to sport, but I think the recognition that we can use sport as a way of raising the profile of this challenge, particularly in the wake of the awful events so recently involving the sport of athletics. And so I'm delighted to be here to look at the ongoing work, to support the work of the Kenyan government in this space through our efforts at World Athletics with e-learning and making sure that our education programs, our work around safe space and safeguarding is completely in alignment with the very good work that is now being undertaken by the Kenyan government.
I want to take this opportunity on behalf of the government of Kenya to welcome the president of World Athletics, who is here also to basically touch base and discuss with us the efforts that the Kenya government is doing to make sure that we strengthen our resolve on anti-doping and also to see the progress we have made on matters to do with preventive measures on gender-based violence in sports. And we have had a very good meeting. In our meeting, we were able to look at issues, the progress, and I did inform him that the government of Kenya is committed, to ensure that we continue to strengthen our resolve, to have athletes participate in competitions with a lot of integrity and
Ako yuto ko kakeit let nebo kayumetab logoiwekab emet eng orititab tetutieng'ung nebo Mashinani eng betuni. Kainenyu ko Chesankaro Sirma ak kabarastaindet nekimite tuwai eng oretab kabarunet ko Naomi Cherotich. Testai ikere Kass TV, kimnatet naet.
With the WRC Safari Rally 2025, Rev Fisher and feel the roar!